It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D. Jenny D. Jenny D.
Hello, my beautiful people. Thank you for joining me with another episode of Spill With Me, Jenny D. Today's Spill With Me episode is brought to you by St. Clair Health, expert care from people who care. Joining us today to talk about injury prevention treatment options and what sets St. Clair's orthopedic care apart, Dr. Shaka Walker of St. Clair Medical Group, Orthopedic Surgery.
Shaka.
Shaka? Did I do right? Okay.
Shaka Walker.
Shaka Walker. Whether you're an athlete taking the field this fall or an average Joe trying to keep up with the exercise routine, staying active can sometimes come with aches and pains, and I can feel it already, or unexpected injuries. So thank you so much for being here today. I really appreciate it. So first of all, Dr. Walker, start by telling us a little bit about your background and what led you to specialize in orthopedic surgery and sports medicine.
So I attended the Air Force Academy for undergrad, where I played soccer, and we had exposures to a lot of different areas of medicine, but orthopedics was what I gravitated to the most as an athlete because I dealt with the orthopedic surgeons with my own injuries. I liked the work that they did. I liked that the patients were healthy and would get better, and I liked the technology that they were able to use. And so after I graduated, I went to medical school at Georgetown on an Air Force scholarship, and then did my residency out in California at the University of California, San Francisco. Treating a military population like I did for about 9 years, it's a lot of younger people, a lot of active people who are prone to get injured, whether it's doing things as active duty military members or their families. And so I've always been closely aligned with athletes, having been an athlete myself.
That's so true. Now, what brought you here to Pittsburgh?
So one of my partners when I was in the military, who was actually an Army officer, grew up in Mount Lebanon. And when it was time for me to get out of the Air Force, my wife and I were living in California with our 3 kids at the time. And we're looking to decide where to go. Were we going to move back east, where we were both from? She's from Philly. I grew up in the DC area. Or were we going to stay out west? And ultimately, we decided to be closer to family. And when I talked to my friend Mike, he said, you should consider Pittsburgh. It's a great place to raise a family. So we came, checked it out, and really liked it.
Oh, I'm so glad. So how long have you been here?
About 10 years.
No way. Yeah. Oh, see? Oh, good. You're here to stay. Yes. So what do you enjoy most about helping people get back to doing what they love, whether it's sports, favorite activities, or just everyday movement?
It's really gratifying to see someone who comes in with an injury or an ache or a pain and help them work through getting better and getting back to their goal. One of the things that was really great about being in the military was that the bases were typically pretty small and there weren't that many orthopedic surgeons. So you'd see people in the office and then you would see them out in the community. And that's the same feel that I get here. A lot of my patients that I see here in the office are parents of kids who are friends with my children or are out in the community living life. And I get to see them at the Giant Eagle or at the Starbucks or what have you after they've gotten better. You meet a lot of people if you're a physician in this community on the sidelines of sporting events, and when they find out you're an orthopedic surgeon, you start to hear about the aches and the pains and the things that they've done, and can talk about kind of what their plan is. But it's that connection that I think makes a big difference. The medicine is the medicine anywhere, but I think that when you have a connection with your patients,
it's so true. I know, because if you were on the sidelines at our sporting events, I'd be like, "Hey, can I ask you a question?" Yeah, and being a part of the community. And, knowing your neighbors and knowing what you do, it's just so refreshing to know that, you have someone who cares. You care about your family, you care about other people's family. So with like football season, though, this is a big subject to me too. My son plays football and other fall sports officially underway. Injuries are top of mind for athletes like my son. I get so nervous with him being quarterback because I'm like, they're all coming after, right? What kinds of injuries do you typically treat this time of year?
So I think you see the full spectrum. You see the overuse type injuries. And so when you have athletes that are transitioning from middle school to high school and the physical demands are much greater, you'll have children come in with aches and pains from running, things like shin splints and tendonitis. You may see an occasional concussion from some of the football or soccer players. Every year we will get a few ankle sprains, ACL tears, some shoulder dislocations, and that's the typical pattern of injury that you see. You'll see smaller things, finger fractures, finger dislocations, and a lot of what happens with these athletes is they're eager to return to play. So getting in to be seen quickly is of paramount importance to them. And so, we are able to get folks in very quickly, see them, and hopefully get them back to the field. Heat injuries are the other things that we typically see this time of year. And it's been particularly hot this summer.
Oh, yeah.
And so with the kids, it's hard to convince the children to drink as much as they should. And so heat injuries can be a big concern as well.
I didn't even think about that, but that's so true because they don't want to stop. They want to just keep going. So the more they drink, they're going to. I totally understand that. How does your experience working with athletes shape the way you treat everyday patients and orthopedic concerns?
So I like to think that all adults were once kids. And what they like to do is play. Everybody has something they like to do for fun. When you think about it through that perspective, you can see an adult who maybe they play in a pickleball league.
I was just thinking that myself.
And they have a strain or a sprain or they've gotten hurt. And you're approaching them the same way you would any other athlete with understanding their goals and then how to get them back to their desired level of care. And that could be a 75-year-old who has knee arthritis and needs to get a replacement, or it could be a 25-year-old who has strained a muscle or injured a ligament.
Right. And that's so true because if you think about it, I feel like we're more active. As we're getting older, you would think that we would stop being as active, but I actually started lifting weights probably about 6 months ago. And I feel so much better as far as my muscle tone, but now I'm feeling the aches and pains in my knees. Yep. So I do have to ask you about that too, is the arthritis in the knees. I think a lot of people that I talk to are like, I have arthritis. Is there something you can do for arthritis, or is it just...
So there's nothing that we know of that will stop arthritis or reverse arthritis. And so the ultimate treatment for many of those folks is going to be some form of joint replacement. But there are things we can do that can help to preserve and prolong the life of our joints. And a lot of them have to do with what you're talking about, like lifting weights, so strength training, working on flexibility, keeping active. And I think that the longer you can stay active, the better it will be for you in terms of the long-term health of your joints. For many people who become sedentary at an early age, or they spend their time working behind a desk, they just don't get the required minutes of activity each week, that 120 to 150 minutes that you need to have. And so the advice I give to most people is you have to treat yourself like you're an athlete, whether you are one or not. And that means getting the right amount of sleep, eating the right diet, and getting the right amount of exercise. And you find things that are fun to do. So, if you don't like to run, then I wouldn't tell you to go out and be a runner, but you have to find something that you can do that's going to get your heart rate up. And some of the things we think about, like biking or swimming, are pretty typical aerobic activities, but I know people who do shadow boxing or they participate in a 9 rounds class. And those are all things that are going to get your heart rate up, and they're going to get you up and moving. And that's really what's critical, I think, to staying healthy and preserving the life of your joints.
That's so true. And I've been doing spin as well, just because I feel like that's easier on my joints as well. Yeah. So thank you. So what advice do you have for athletes or active adults looking to stay injury-free right now? So if, for instance, like people that are playing pickleball, or, an athlete that's going out that has been doing sports all year round, because, with your children too, right?
Yes.
Some of these sports are all year.
Yeah. So I think for the younger athletes, I would say that if you can avoid becoming too specialized too soon, that helps. There is a definite tendency now for every sport to want to occupy all seasons. And so if you have a son or a daughter who plays basketball, they may play for their school, and then they may play AAU, and then there's an opportunity to play in the summer. Baseball is the same. Their principal season is in the summer, but they'll have fall ball, and they'll have some winter batting practices, and they'll have something in the spring. My kids play soccer, and it does become this year-round phenomenon. And that is what I think leads to the overuse injuries, but it also takes away from their athletic fluency, learning how different body parts move and how to control them, how to start and stop safely. little kids used to just go out and play, and that was what they did. Now a lot of them are on screens and maybe not as active. But if you think back to when we were kids and the internet didn't exist and no one had a smartphone,
Right.
when the summertime hit, your parents just opened the door and said, "Be home by dinner," and you just went out and ran around.
When the street lights come on.
Or they'd whistle and it was time to come home.
Exactly, yeah.
And I think that, for adults who are trying to stay healthy and remain injury-free, they have to sort of rekindle that sense of play that they had when they were kids. So if you have a basketball hoop at your house, get out and shoot around. Get out and do some stuff that maybe you don't do all the time. Go for a walk. Sleep is probably the biggest thing. The injury risk for athletes when they don't get 7 hours of sleep jumps about 70%. Yes. And so, for the kids, I always tell them, get a good night's sleep. Sleep is when your body resets itself. For adults, it's the same. And we're busy. Maybe you're carting kids around to different activities. You're busy with work. You're busy with home. But if you can't get adequate sleep, then your body is not going to be as healthy as it should be. And I think that combined with proper nutrition is really probably the key. And then surround yourself with people who have good habits, because if you have 3 or 4 friends who are active, you're going to be the 5th one. And if you surround yourself with people who are inactive, you're also going to be the one who becomes inactive.
That is so true. That makes a lot of sense too. Because now my friends were all trying to do something active during the weekends instead of just going and sitting at a bar or something like that, or having a drink or two. Because now I feel like as we get older, sometimes we're hesitant to do the exercises because I don't want to hurt my knee, or my back has been bothering me, or my shoulders. But I like that you said stay active. Don't just make yourself feel like, just because your knee's bothering you, get up there, get out and do a little bit of exercise, because it may even help if it's bothering you a little bit.
Yeah, oftentimes being active will make you feel better than if you're completely shut down and sedentary. And you look at cultures around the world where they go for a walk together. In Spain in the afternoon, you'll see an entire family, grandparents all the way down to grandkids. They go for a walk. Just that activity is good for the mind, good for the body, and it helps to keep you more active. And that's, I think, a big thing is that, we become very compartmentalized in terms of how we think of athleticism and sports. And if it's not a class, if it's not structured, then it's not the right thing. There's so much open space and green space here in the Pittsburgh area. You can get out on the Montour Trail and you can walk or you can bike. You can go through Boyce Mayview Park. There's hiking trails there. You can go for walks there. It's just about trying to find something that you can do each day that helps you to kind of take care of yourself, to reset yourself, to kind of keep your mind at peace. And when the weather gets bad, you can still go out and do those things. We lived in Germany, one of the places we were assigned, and we were in a little farming town. There were more cows than people, but all these little villages were connected by trails. And we would go out, have the kids on a backpack, and you'd go and walk. And then when they were old enough to walk, they would walk as well. And you might walk 3 or 4 miles in the snow, but they would do this, the Germans, on the weekends, just walking from village to village in large groups of people, just sort of essentially trekking, and nothing really technical, nothing really that hard, but just out for a walk, rather than being stuck at home, because if they only went out when the weather was good, they'd never go out. And, when I say here in Pittsburgh, people complain about the weather. We lived in California where the weather was perfect all the time. Right. But I would say, if you think that the weather is bad here, it really isn't. There is a season for everything, and there's an opportunity for you to be out and about virtually all year round. I know people paddleboard on Peters Lake. Yes. That's a great activity. You can also go up to North Park. They have a similar thing to do, but it's about finding something that's fun that you can do that gets you out and moving.
I love that. And I love that doing family activities. I'm glad you talked about that, Dr. Walker, because that's so true that, getting out there with the whole family, and like you said, and people, surround yourself with people that do like to exercise, that do like to do different things. We have so many beautiful things in our city here, just going to Lawrenceville and just walking around there and just seeing the beautiful sights. I mean, we are very fortunate here too. What does the patient journey typically look like at St. Clair Medical Group Orthopedic Surgery, from like your first visit through your physical therapy or your return to it?
So for us, a first visit is all about us getting to know you. We want to understand, what are your goals? What is it that you're passionate about? What is it that your injury or the ache or pain is preventing you from doing, so that we can understand how to come up with a treatment plan that helps to get you there. Imaging and things like that are done here on site. We do have physical therapy on site as well, but we have a lot of connections with physical therapists in the community. And it's just about trying to find the right person to take care of you. Then there's the follow-up visits where we can kind of gauge what kind of progress you've made, whether any other interventions are needed. And then moving from there, hopefully getting you back to a treatment plan. Typically not with surgery. Most of our patients get better without ever having had an operation or any sort of procedure. For those who do, the surgery can be done here as well. And then we get you back into the rehab phase so you can get back to life. And then the nice thing about what we do is we can do check-ins with you here in the office, but oftentimes our check-ins are, like I said before, I see you with the giant eagle, I see you out doing something,
Right.
you know, with your family or with your friends. And that's my follow-up, is that I know that you're actually back to your activity.
Yes, I love that. That's so true. So how does a collaborative approach with physical therapy, we were talking about this, imaging and other services, help you deliver seamless care that gets the body back in motion and keep it there?
So I think the most important thing for me is to recognize that all of this is about the patient's story. There's a book we had to read when we were in the Air Force, 10 things you do differently if Disney ran your hospital. And they take principles of how the theme park actually trains their staff to make you feel special. And I think that a lot of healthcare is designed around the people delivering the care.
Right.
But really, you want the healthcare designed around the people who need the care, who are receiving the care. So I view my role as sort of part listener, part coach, part communicator and coordinator with other entities that are there. And so I try to maintain very open lines of communication with the physical therapist. So if I send you to see somebody, they have a concern, they can call me and we can talk about it, try to modify your plan to figure out what we need to do differently to make you better.
Right.
And then with radiology here, when you have your imaging, I can talk to the radiologist directly about what they saw. But I think the key is just to recognize that I see you for a visit that might last 20 minutes, but you're living your life in all the minutes that you're not here. And so what I have to do is try to find ways to get the information I need from you and from the others who are caring for you so that we can work together to come up with a plan. And it's collaborative. It's never prescriptive. You tell me what it is you'd like to do. We kind of try to work through that. It's rare that we're saying no or you should do this. It's more just trying to help you to understand, like, how does what we're talking about doing for you, what we're planning, affect this body part so that you're better educated about how the injury occurred in the first place and how you can get better. And I think that's the key thing for me.
Oh my gosh, thank you. You really answered that great. What else sets St. Clair Orthopedics team apart from others in the region when it comes to treating sports and orthopedic injuries?
So I would say that the biggest thing is each of the physicians in the group have children and most of them play sports.
Right.
So it gives us a perspective of having been on the sidelines. I coached youth soccer in Upper St. Clair at the rec and travel level. My kids play at a more competitive level. And I think because we're out on the sidelines, because we're the ones taking these kids to practices, we see all the things that are done right, all the things that are done wrong in terms of how kids are being treated as athletes. We see maybe a little bit more intensity or more frequency than they should have in terms of their contact hours. As the parent, you see that your kid isn't getting enough sleep because they're on screens and you're trying to manage that. I think that human connection of just recognizing that we're not just the sort of nameless physicians or, generically the doctor. We're also parents and people in the community, and we care about this community. So we want people to be healthy. I would find it preferable to never have to do an ACL reconstruction on someone's kid if we could figure out how to prevent it. And so those are the conversations that I have with people. And this is something I've lived. My own daughter had an ACL tear and had to have surgery and missed her entire junior season of soccer. And that's bad luck, but maybe there are things that we could have done differently that would have prevented that. So that's kind of what animates me, is how do you try to keep a community healthy, which means creating conditions where they're not here, where they can just be out kind of managing themselves and not have to see the doctor. And I think
I like that. Keeping the community healthy. I love that. That is so true. And it's true that you're a parent, so you see it and you know what it's like, and so that you can relate to other people. I really love that. So for someone listening who's dealing with like joint pain or lingering sports injury, how do they know when it's time to see a specialist? Because I know for me, sometimes you think it's just going to go away, or oh, I'll just put ice on it, or I'll just take ibuprofen. So how do you know when it's time where you're like, all right, I need to see a specialist?
Yeah, I would say in general, if this ache or pain is lasting more than 2 or 3 days, if you're having difficulty performing normal day-to-day tasks, if you're having to take medication, like self-medicating for it, if you're having a hard time using that extremity, probably should get that assessed, particularly if there was some trauma or injury associated with it. Because typically, it might be the case that that problem is going to resolve over time, but it might be that it would resolve faster if you saw someone and they could kind of point you in the right direction with a treatment plan. So I don't think there's a reason, to avoid seeking care.
Yeah, and I think that's the hardest thing is, we don't want to waste anybody's time. So a lot of people are, oh, I don't want to go to talk to an orthopedic surgeon because maybe this is just something that I tweaked and it's going to go away. So I think that's hard, as people that, especially in my age group, I feel like, oh, well, it's just because I'm getting older. I should be expecting these aches and pains. Is that true?
I think to a certain extent there will be aches and pains. I'll say if you take your 20-year-old self and your 40-year-old self, there are some big differences in terms of how your body can absorb load and how quickly you can recover.
Right.
That being said, if you have an injury, if you've done something, you slipped, you've fallen, you reached funny and you felt a pain and that pain is lingering, you should definitely get checked out. I don't think that's something to sit on. But I do think, an occasional ache, if it's in the muscle, that's okay. If you're feeling aches and pains in the joints themselves, then that's something that's worth investigating.
Okay, that's what I was figuring. Thank you for answering that. But what message would you share with someone who thinks they can continue to tough it out, like we were just talking about, instead of seeking treatment?
I would say that if you would like to get better faster, come in, be seen. Because we can probably help you understand why this problem is occurring and help you come up with a plan for how to get it better so that you're back to what you're doing sooner. There's sometimes fear, I think, that people have that if they see an orthopedic surgeon, that we're going to lead with the surgery, that that's what we're about.
Exactly. Yes.
And that's absolutely not the case. As I mentioned, it's preferable for me not to have to treat you with surgery. So I see surgery as the last intervention that we could offer. And if there's something less than surgery, that's what I would do. If there were a pill that cured arthritis, I'd give it to you.
Oh, please. I'll take it right now.
So I think that for me is something that people have to understand. And because we're connected with this community, we know that how we treat people here is going to be something that reflects on us. And what we want is to make sure that people have a great experience, that they get excellent care, and that they know that the people who are taking care of them are treating them just like you treat your neighbor.
Right, and that's why I love it here at St. Clair. Is there anything else that we didn't touch on, Dr. Walker, that you would like to tell the listeners and viewers?
I would say the main thing is, and this is sort of my theme, is stay active, be active. I think that the more active you are, the healthier you will feel, the longer you will live. And I think that that's the key. And do things together with your friends and family. I think that also really helps. In this day and age, we get so disconnected from each other. People are so busy. Find time to connect. Find time to be with the people that you care about.
I love that. Thank you so much. This was so great. A big thank you to Dr. Walker for joining me today. It's clear that the patients are in excellent care in hands here at St. Clair Medical Group Orthopedic Surgery Team, whether they're recovering from a sports injury or chronic pain or just hoping to stay active for years to come. This is the place to be. If you're dealing with pain or mobility issues, or you just want to get ahead of your injury before the sidelines of your lifestyle, you don't want to stop completely if you don't take care of it quickly. Now is the perfect time to take the first step. Call 412-942-7262. I'll have all that information underneath to schedule a visit with Dr. Walker, who sees patients in the St. Clair Dunlap Family Outpatient Center located in Mount Lebanon. So this was another episode of Spill With Me, Jenny D. And thank you so much for St. Clair for sponsoring this episode. And thank you, Dr. Walker, for your time.
Thank you for having me.
Take care.
Come spill with me.